A very good morning to all. Today I am so happy to introduce Dr. Ananth, Senior Consultant General Medicine, Apollo Hospital since 1999. He is a Senior Consultant, National Health Service UK and currently at North Cumbria University Hospital. He works for the Royal College of Physicians as a Senior Tutor and Examiner for MRCP examination both in UK and worldwide. Dr. Ananth is a mold of rich traditions, high-value ethics, maintains communications and very empathetic in his practice. His teaching skills in both UG and PG in India and UK has been well recognized. Dr. Ananth has also driven the aspect of preventive care successfully over several decades and we are going to derive from his rich experience today. So the topic of today's live session will be the preventive care above 60. Thank you, Doctor, for joining us. So, Doctor, to start off the live session, what do you want to tell about the preventive care above 60?
Well, thank you, Asha. This has been a very generous introduction and very pleased to meet all the viewers and my dear friends across through this lovely social media of today. Preventive medicine is I think, is the most important aspect of medicine, which has been highly understated and underemphasized. And I am very proud that I've taken it up as a message throughout my practice. Even though I am specialized and subspecialized, I give one part of my work towards overall prevention, Asha. So even though I am concentrating on one organ system at one point in time, I still dwell backward and look at the individual as a whole and not as a part of it. After all, human body is one. So we need to organize our care in such a way each organ is in synchrony and in peace with other organs without interference. And this is where we need to look at the preventive aspect of it as well. There is no specific chart or agenda initially, when somebody is studying the art of medicine to begin with. But in course of time, we have understood with our own knowledge about offering what is known as the preventive medicine, which has now become a very big subject throughout the world. After all of us know that prevention is better than cure. It cannot be understated. It's very important. Thanks to modern medicine and vaccinations and immunizations, the longevity of these patients, population today has increased. The people tend to live longer, and prevention also, there's no age. You can start preventing from any age as early as one can imagine. By way of disciplined diet habits and exercise and yoga and meditation, have a balanced life, you can always prevent disease and put them at bay and make them come much later, several decades, as they all started now to come much earlier these days. Technically, from today's point of view, we have taken as subject as prevention after 60. I know most of you would have questions that you generally concentrate on diabetes, hypertension, lipids, cholesterol-related abnormalities, and so on and so forth. So these are broadly called as an NCD, or non-communicable disease. Infections are communicable, these are not communicable. They exist only for the individual, and it's a combination of their own genetics plus their own lifestyle plus the environment. All three act together and eventually these people get a disease like a hypertension or diabetes and so on and so forth. Is there any question specifically like
yes, Doctor. So we have a question here. What are the general aspects I should get myself checked? How frequently should I take blood tests?
To begin with, as I said, as a baseline, it is always better to have all the blood tests, most of them having a full blood profile, which involves the hematology, the white count, blood count, red count, hemoglobin, and a general blood profile like glucose, kidney parameters, the salt levels, the cholesterol, and the liver function test. It's a very good question, but I don't insist that they ought to be monitored every now and then. For instance, if somebody is a diabetic, if we find it on the baseline examination, then it makes sense for them to follow the sugar, glucose every now and then and leaving the rest of the things. tests, at a much later frequency. So it is a frequency that is important. And if someone has got the odds of a particular disease, then I tend to cast an eye more sincerely on that particular illness which is likely to come. If they have a very strong family history of diabetes, even though if the patient doesn't have a diabetes today, I will tell them that you have a very high risk. You need to keep your weight at bay, you need to exercise regularly, and then keep an eye on your sugar going by today's readings.
We have a question from Praneet, doctor. Hi doctor, good morning. I get seasonal coughs, cold and throat pain. How can I prevent it?
Unless you don't get exposed to the season, the very description of seasonal itself should be quite reassuring that it's not going to be happening 365 days of the year. Much of it is due to avoiding the allergens and exposure to climate, and the way in which you're exposed to the dust and pollens and allergy by way of adequate precautions. And taking some kind of a medications as a preventive measure just about the season starts, just about the first cough, just about the first sneeze happens. And that time if you can start the preventers, that will help you to overcome that bit of an illness. I won't say whether to get cured, but you will be much better prepared to face the illness and reduce the number of or incidence of that cold cough attacks in a particular period of season. Or even though you do get the actual disease, but you get it with much lesser intensity, and your life is not thrown out of gear for too many days at a time.
One interesting question. Hi doctor, women horlicks is something I see in shops regularly. Do these drinks really help? How frequently can I consume?
Honestly, I don't know the components, but I know the awareness has taken us this much. Women's horlicks, as is possibly the knowledge that stems out that post-menopausal, because the woman loses the protection of the hormones, they tend to have an osteoporosis or weakening of the bones. I describe it like a concrete in a particular wall. It has to be strong. Once you lose that, you get pain and you can get fractures once at a very advanced stage. I think these Horlicks supplements aims at topping up your calcium than anything else. So you can either do that way if it is having the actually recommended amount of calcium either in your diet or by way of proper pharmacological supplements rather than relying on the food supplement alone like this.
So there is a question from Suresh Kumar. My grandma is 85 years old. She doesn't have any major sickness. How frequently should I take her to the hospital?
There's no need to go to the hospital. Don't bring her to the hospital at all. I think I'm sure you love your grandmother as much as I do. Don't bring her to the hospital. Go to your doctor and let him do a full spread of tests, and that is enough. And if there are anything that comes up in terms of high blood pressure or sugar or metabolic abnormalities, then you can always approach it. But what is important for grandma at this age is make sure she has got good eyesight. Take her to the eye doctor. She doesn't have a cataract or retina is all right. Make sure she can hear better, because she should be able to walk around freely in the room, safe enough so she's got her feet firmly planted on the ground and not fall down. And that is very important. She has a good balance and her senses are all right.
So the next question is, what is your opinion on yoga for seniors?
Yoga is definitely good for seniors, not only for seniors, at all ages. It is essentially a breathing exercise, but then it casts such a beautiful effect throughout all the systems. It works with the autonomic nervous system. It controls the pulse rate. By controlling the respiration, your heart sounds better. Your overall mood becomes better. You can withstand the day's challenge far better than anything else. So yoga has got unquestionably a beneficial effect for all ages, especially in old age. When the joints start becoming stiff, the yoga practices helps you to relax your joints and gives very good stretches, so you suffer less in terms of pain when you move around at that age, when you are likely to be crippled with arthritis and bone pain due to osteoporosis.
So the question is, can paracetamol be taken for body pain and fever?
It is the first drug of choice. It still remains the first drug of choice, and if at all one gives the right dosage of 1 gram to a maximum of 4 times a day, it is still the best drug of choice.
We have 3 questions from Health Above 60 clients, doctor. So my mother is 62. She has stiffness problem when she gets up in the morning. So what will you advise for her?
Early morning stiffness, if you are testing my academic knowledge, I can give you about half a dozen causes. It is always better to get examined by a physician, and if he can do some basic blood tests to check if there is any inflammation that is going on. Inflammation means small bit of fire. When we say inflammation is fire, flammable, which means if there is anything that is causing irritation of the joints, then the doctor would do further tests. If there is an arthritis test, he can go a little specific. And that's how I would approach the patient. Yes, get her first examined and do a very basic evaluation.
So the question is, what is the right diet during chilli season and how to avoid food-related infections?
Right diet during chilly seasons. Personally, I'm not sure about that. I've not read scientifically anything, but definitely pays better to have warm water in your day-to-day livelihood. It makes you to feel better. It soothes your chest very well. It maintains. You have to maintain hydration. That is very important than anything else. Whether you can drink cold water or hot water, water is very important because we tend to consume much less water during winters because we are much less thirsty in this part of the world. Therefore, we tend to consume. And elderly people will tend to consume less water because they don't want to visit the toilet as often. So I would say encourage yes water, or warm water maybe generally makes you feel better, your digestion improves, your chest improves. It gives a very good medicinal effect. Sometimes it's very good actually. I tend to impress the patient. I even write there like a prescription. Can I write it like a medicine? They say no doc, I understand that. Yeah, I'm free to use the warm water. But other than that, yeah. If somebody likes a hot plate of bhajis to celebrate the winter, I don't mind at all.
So we have the last question.
And ask me, when you have a bhaji, invite me, I'll be there.
So we have the last question of the session.
Yeah.
So how to balance sugar and salt in elders' diet?
As long as they are not diabetic, you don't need to be restrictive on them. Salt is very important. The lower the salt, the better it is. Currently, there is a very renewed knowledge and campaign against the salt now. So, I would say a maximum of 5 to 6 grams per day, which is about a teaspoon flat top generally delivers 6 grams. So if you can divide that, that's very good. Too much of salt can obviously damage the kidneys. It can retain the fluid and cause more swelling because they may be taking some medicines already to take for the heart failure or other conditions to drive out the water. By taking more salt, you're only retaining more water and you might need more medication, and that might complicate the issues. So yes, low salt diet and normal sugar, if they are not diabetic, it should not be a problem at all. I can't think of anything.
We are done with the questions, doctor, for the live session. So anything you want to tell to the viewers regarding the...
As I said, continuing from where we started, the first thing in this talk is that we're talking about non-communicable disease, which is very important. It starts with the middle age, but after 60, you have to go for a good eye test and your ears test as well. If you go by, now let's divide it a little further and look at it as gender-based. Cancer is a very dreaded thing. Nobody likes to have the cancer, the big C. Nobody likes it at all. For the women, we know that we advise people to have a mammogram and a pap smear. A smear test gives the indication of a possible cancer in the cervical, birth canal area, and a breast cancer is again dealt with by a mammography, which is a very specialized form of X-ray combined with some ultrasound techniques. So the campaign there starts very early for emphasizing the value of self-examination, and then when you attend these sessions with me, so I would recommend to do a mammogram. How often to do the mammogram? Nobody knows. Okay, that the doctor will tell you. The examining specialist will be able to tell you. There again, what happens is that unfortunately if you are in a family of women who have got nodules and lumps, then your odds go up. So they might tend to increase the frequency. Say, ma'am, you have to do it every year. Or whereas for your friend, it may be every second year or third year. So it just varies. The important is to have the knowledge and be aware of this. And the birth canal cancer. These are all proven as preventable disease, which means you have to understand that if you do these tests and these convey early stage cancer and you deal with this cancer, it is cured. Only this has passed the test of statistics and say it's a screenable disease. This perfectly, the value of screening is there. If you ask the medical world, this is it. So there aren't many other screening diseases. But if you do a chest X-ray, you still look for a cancer there. If you do an ultrasound abdomen, there's a test for cancer there as well. So coming back, for the women, we have these breast cancer and cervical cancer, like a campaign, we do that.
And doctor, we have also the vaccination for the cervical cancer, like three times vaccination in every 3 months.
That is a different concept, but it's catching up with the world. There are many causes of these cancers, and especially for the cervical cancer, it is a virus that is very, very important, which catches, girl children at a very, very early age. So that is why that has come. The vaccine actually helps you to overcome that virus, which when it stays for a very, very long time can turn into a cancer. That's very important.
So any particular age, doctor, to take the vaccination?
I think it starts very early, if I remember right. It's very, very early, like in the second decade, it starts there. Okay. That's good. As far as the men is concerned, there is nothing like specifically, but we add a test called prostate specific antigen, which is a blood test. Prostate can be enlarged with men after 60. And when it's enlarged, it can be quiet, but more often you'll see people who have difficulty in passing urine, or they can't stop the urine, or they take a long time. So these are all the physical problems of an enlarged prostate, which in the modern days can be managed with medicines. But a small percentage can become cancer. We don't know which one becomes cancer. This is when this blood test is very, very useful. So I tell my patients to demand it to be done. But that alone is not the only way. We look at it from many phases. Just as we see from any object from 360 degrees, it has to be done by a clinical examination. The surgeon examines with their finger the prostate, and then the ultrasound, we can do a scan and measure the prostate. And with that, with available information, and they examine the patient, then they choose to do further tests. If there is suspicion, then they do a needle test or a biopsy to confirm it. So this is how you tend to go at an age of 60 and plus. So there are a few other things like you can test your thyroid. For women again, postmenopausally, we do a simple X-ray to check the bones cement, as I said, the osteoporosis, as we call it, the weakening of the bones. That's when it fractures the bone straight away. So once we demonstrate that, we give some bone supplements which they can take on a weekly basis, plus extra calcium, and that can make the bone strong. It can prevent the fractures happening in the spine, which is the big bones on the back bones, which are very chunky and they bear your weight, and the hip bones, which is where the fractures happen most of the time.
You can conclude the session, doctor. So,
to conclude the session, the best way is I would say that you should concentrate on your health by going to your own physician and asking him or her to conduct a thorough physical examination, and supplemented by good investigations, and doing these screenable diseases like important diseases, and also offer them a good family history, so the doctor will be in a position to discuss with you what are the risk factors that you are likely to have, and then look for those diseases specifically and then advise you. I hope it's clear.
Yes, doctor, thank you so much for joining in the live session. Thank you once again.
Yeah, welcome, Asha. Thank you.